Here's a stat that I wasn't aware of until earlier today. 1 in 4 of us in Ireland have issues with varicose veins. So I was curious, and I'm going to satisfy my curiosity now in late lunch, because I'm joined on the line by Mr. Peter Naughton, who's a vascular surgeon at the Bon Secours Hospital. Afternoon to you, Peter.
Hi, Gerry. How are you today?
I'm very good. Thanks so much for joining me on the show. Well, this one caught me on the hop a bit. 1 in 4. Can I begin by asking you, what's the cause of varicose veins?
Well, as you said, yes, varicose veins are a very common condition, Gerry. They're caused because the valves in your veins, there's valves in everyone's veins in your legs, and what they do is they act like gates, so they open to allow blood to go from your leg back to your body, and then close to prevent the blood going back down your leg. What happens with varicose veins is, for one reason or another, these valves don't close properly, and so blood can go back down into the leg and fill up the veins in the legs with blood.
So they become prominent then. You'll see them. Is that it, Peter?
Exactly. So varicose veins are where you see swollen veins just under the skin in your leg. You can even feel them just under your skin.
And it's mainly in the leg and the lower part of the leg, is it, that you'll have?
Well, it can affect any part of the leg, either the thigh or below the knee. But it's something that can vary in presentation. So some people, it's just a cosmetic issue. They see a small swelling in the leg. For others, they can be quite troublesome. They can cause a number of symptoms like pain, itch, swelling. And if left for a long period of time, they can cause more severe problems like skin changes in the lower part of the leg and even ulcers in the leg.
Serious indeed when it comes to that stage. So tell me this, is it hereditary or is it something that lifestyle can bring on?
I think yes to both parts of that question. We don't know why valves break down or don't work properly, but certainly risk factors like a family history can put you at increased risk of getting varicose veins. Other risk factors that have been clearly identified are in people who stand up a lot, particularly in their professions, people who are women who've had multiple pregnancies, and age can be a contributing factor. But then again, I also see them in young men who had no family history. So it can be a very diverse group of people that can get varicose veins.
So if you're on your feet working, there's nothing much you can do about that. Is there any precautions you can take or something that can assist you? Or, in terms of lifestyle, what should we avoid?
Well, there's very little you can do to prevent getting varicose veins because there usually is a genetic component. But there are simple measures you can do to alleviate them and decrease some of the symptoms. So if you are standing up a lot, wearing compression stockings, particularly ones that are properly fitted, they can then improve the symptoms, and elevating your leg in the evening time, if you get time to rest in the evening time, can also improve things. But these are really just supportive measures. They can alleviate some of the symptoms. But really, to get rid of varicose veins, you should at least consider being seen by a vascular surgeon, and he or she will consider surgery to get rid of these veins for you.
Now, you are a vascular surgeon. Do you see more men than women, or vice versa?
Well, I see a lot of patients with varicose veins. I guess there is a higher percentage of females, but it would really be 60-40%. So see more and more men, and certainly what we're doing now is doing patient information days to bring it to people's attention that it isn't just a cosmetic condition, that it is a medical condition, and if unchecked, untreated, can progress. So we are seeing more and more men as well with this problem because they are presenting to their doctors, whereas before they may have just covered up their veins and tried to forget about them.
So let's say I go to see you and I have an issue with varicose veins. How are you going to treat them for me? I do know from the past there was a procedure called stripping, and it could be quite difficult and painful. Has that been superseded by something new, Peter?
Yeah, so traditional operation required a general anaesthetic, so a tube down into your lungs to help you breathe, and usually involved a scar in your groin and then stripping, as you've said, Gerry. It's a good operation that it did get rid of veins in the vast majority of patients, but it's associated with pain and a very slow recovery period and your risks of infection. What I'm doing and a lot of my vascular colleagues are doing now is minimally invasive keyhole surgery. So what that involves doing is we usually do the operation under sedation rather than general anaesthetic. We generally make a tiny scar, less than a centimetre in size, around the level of the knee usually, and through that we then put a little probe or catheter or tubing that goes up inside the vein. So you're doing most of the surgery from inside the body. What that then does is it generates a heat of 120 degrees, which causes internally the vein to shrivel up. So while it sounds complex, it's quite a patient-friendly operation. That it's a day case operation. Patients go home that day and are usually up on their feet and doing their daily activities the following day. So more and more it's becoming the more popular operation. And certainly the guidelines from the UK and the States would be that patients should be offered this as the first line operation for varicose veins.
Just had a message from Brendan, who's listening, to say that he had his veins done just before Christmas, all done with laser, in and out in the one day. Fantastic, he says. So there you are. We have somebody who's listening who's had the procedure done. I'm very happy. Good to hear, isn't it?
Yeah, it is indeed. I mean, I certainly would see some patients who've had the traditional operation and then go for this newer operation on their other leg, and certainly their reviews would be a lot more favourable for this newer technique.
Now, when I have it done, do I have to mind myself post-operative in the months and years ahead? Is there any chance they'll recur?
Well, the most noticeable thing you have to do after the operation is to wear stockings for a month, and thereafter usually you don't need to wear stockings. We are usually very successful in over 95% of the patients. That is all you need to treat the varicose vein. There is a recurrence rate. It usually, if it does happen, it happens in another vein that hasn't been treated, and that recurrence rate over a 10-year period is about 10 to 15%, and that's the same whether you have an open operation or this newer laser operation.
And in terms of expense, is it covered under the main health schemes?
It is indeed. I mean, we offer this operation to public patients in Beaumont Hospital where I work, and also for private patients. I would do a lot of these in the Bon Secours in Glasnevin. Now,
for listeners in the region here, and we have a lot of listeners into Dublin and beyond as well, I say hello to them this afternoon. You have a special evening on this evening at DCU. Tell us about that.
So it's actually tomorrow on the 28th.
Sorry, I beg your pardon. It's Thursday. I'm a day ahead of myself, Peter. God, that's good news for some, not for us.
Yeah, they have a little bit more time to prepare themselves and read up and ask me questions tomorrow, Gerry. Yeah, tomorrow we have an information day provided by the Bon Secours Hospital. It's in the DCU Innovation Campus, which is across the road from the Meteorological Centre. It's on at 7 o'clock tomorrow. For those who are in the Drogheda area, I'm also doing a patient information day on the 4th of February in the D Hotel. So it's open to all. It's free and there's no commitment one way or another. But really it's just information to talk about varicose veins in detail. Hopefully not putting anyone off the operation. We'll show some slides as well, just to give you a flavour as to what we have to offer patients with varicose veins.
And are those both tomorrow in DCU and the D Hotel in Drogheda on the 4th of February at 7 o'clock? Are those free information evenings?
They are both free information, yes, indeed.
Another question from a late lunch listener. Gerry, would you ask the doctor, I have a blood clotting factor and issues with veins. Would this preempt me from having the procedure?
So in circumstances like that, it's a case-per-case basis. Certainly in the past, you would generally be treated with compression stockings. But more and more with this small keyhole surgery, we are operating on patients who had been declined surgery, whether they were too sick for surgery or whether they had bleeding issues like your listener or on medications like warfarin. So really, we keep an open mind about that until we see the patient and get a little bit more idea as to what their varicose veins, how they're causing problems to them. Gerry.
Peter, so informative. I thank you for joining me on the show today. There's a lot there to think about, and again I remind listeners, it's tomorrow night, it's at DCU beside the Met Erin office there from 7, and then Drogheda D Hotel on the 4th of February. Thank you so much, Peter.
My pleasure, Gerry. Thank you, and take care
of yourself. Not at all. Take care. That's Mr. Peter Naughton there, vascular surgeon, works in Beaumont and operates with the Bon Secours as well. So there you have it. It's an issue for 1 in 4 people in Ireland.